You're just holding the mic the whole time, like, hello.
And my fist is
Just get closer to their face.
hello. Yeah. Hey. Hello, GUL. This is Nikki McGregor. I'm the founder of the GUL Network, Gathering of Lightworkers, and this is our Lightworker Radio podcast. And we do our interviews with our new professional members, and we get very excited as a community to share all the different wisdom, all the different modalities that are out there for holistic, natural, non-invasive ways to be able to heal our bodies. And I know many of you are on your own healing journey, and it's just really exciting to be able to share all these exciting ways to heal. Mm-hmm. And I have Marissa on, and so I'm going to go ahead and have you introduce yourself and just kind of share like your business and what you do.
Absolutely. I'm Dr. Marissa Shupperd, and I own Body Balancing Physical Therapy. So my practice really combines orthopedic physical therapy, pelvic floor physical therapy, and energy medicine all together. And it really came out of my own journey with a lot of different pains and my own issues we can talk about a little bit later. But really, my goal is to help people in pain get their life back. And those are the tools that I use to get you there. And it's just a beautiful, beautiful mission.
And I've been looking for somebody that is a physical therapist for a while now. And my background's in 20 years of physical therapy, and I left that and now have this organization. But there's definitely different types, in the kitchen, right? Different cooks in the kitchen. So there's a lot of different tools that we can use in physical therapy itself. And so honestly, working with you and getting to know you, you're probably one on just a handful of PTs that I've worked with that truly look at the whole being.
Yeah.
And I love that you're incorporating that energetic medicine and the emotional components and the physical, and on the spot being able to differentiate, have the clinical diagnosis and the differential between that, but address both.
Yeah.
Because that's what we need. Do you find that maybe just in general practice that we're missing that mark a bit? Yeah,
and it's not necessarily practitioners' fault that that's happening either. I know you're aware that our insurance and healthcare system makes it really hard on providers to be able to critically think and dive deep with people. I've been blessed in my career to work in facilities where I'm not as reliant on insurance, and I had the time and space to learn and meet people really where they were at and do a deep dive. So that really put me in a place where not a lot of practitioners get to be. A lot of practitioners are in burnout 100% of the time of their clinical day, and they're seeing patient after patient. There's no time to even put your hands on your client and feel and really listen to the body. So that was a big step up, just being able to have the time and space to learn and see the body, and then, like you said, have the time to diagnose, have the time to then retrain movement patterns, and have the time and space to go deep into emotions and energy. That's not something that can happen in a busy clinic, right? With people walking around, it's not a space where people are comfortable opening up.
Well, and I think that's where we're heading into in healthcare in general. Moving out of that model of this hustle, right? Just the next one, the next one, the next one. I worked in different levels in physical therapy, and it really just felt like a revolving door.
Yeah.
And I did my best, like you said, like you just do your best to get your hands on people and really address the root cause of what's going on.
Yeah, and that hustle I've been reflecting on a lot over the last couple of weeks. Even as a teenager, as a child, I was go, 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 do multiple sports, perfect grades, all of those things. And that was something I always put pressure on myself for. It wasn't from my household. I think it was within, but also just our culture in general. Right? Yeah. We don't celebrate rest the same way that we celebrate accomplishments. Even through college and grad school, I worked, I did all of these things, and those were wonderful and made me the practitioner I am today. But now that I'm seeing no more than 4 people a day, I have my brain back. I have like my time and space back. Time is relative when you own a business, obviously. But I do feel like I have this spark that I haven't had in a long time. And don't you want your provider having that spark, to be able to like be so filled with light and love for their practice, and how things are set up in our healthcare system just doesn't, I never felt that spark before.
And it's hard when you're in the traditional setting, but it does flow over. If you, I mean, everything's frequency and energy, and that vibration. And so if you are feeling that pressure, that's going to flow over to your client, your patient.
Yes. Mm-hmm.
And I personally am seeing you as a client, and you take the time. You are in the moment with what's going on in my body. Mm-hmm. And I think that's the difference, is when you're in the traditional setting, it's like very loud, it's fast paced, and on to the next thing. And so I think that's what I really appreciate personally about your approach, your environment, your setting, and how you manage your business.
Yeah.
So I appreciate that.
Well, I appreciate that too. It's taken me a couple months to settle into that, because I'm used to thinking, okay, I got 5 minutes, next person's coming in, I gotta finish this note, you know what I mean? And I don't have that anymore.
Yeah.
And settling into that presence is really fun.
Yeah, yeah. So what inspired you? What inspired you to embark on this journey?
Well, I'll give you a short answer first, and then I've got a longer answer too of how I kind of got here. But ultimately, I was taking a deep look at where healthcare is going and what this system is turning into, and I ultimately don't want to work in it. I want to be outside of that and work with people who I know understand the value of that as well. Mm-hmm. Because of all the reasons we've just mentioned, I don't think the workload that I was taking on was sustainable for me. And I wasn't in a very busy clinic. I mean, I was busy all day, but there are some clinics that see a lot more patients. So I just knew, wow, if I can't manage what I've got on my plate, it's just not going to be sustainable for me to do it when I'm a mom, for me to do it, when I have more to take on in my personal life as well. So that was really the jumping point for me to take this leap, and knowing that I can do it. I have the confidence in myself. It just took things coming to a head, and for me to really get clear that I want to work outside of that system.
Mm-hmm. That leap of faith, really.
Yeah, the leap of faith. And I have a really special mentor in Texas who I called when I was considering some different moves, and I was explaining to her what I was thinking, and she just stopped me and she said, Marissa, no, you need to be outside of insurance. You can do it. And that's all I needed to hear. And I got off the phone with her. I was at the river, which is where I go all the time when I need to contemplate things. And I just cried because I needed that person to tell me that I was worthy and that I was good enough to do this. And then it was like, let's go.
And isn't that amazing how probably for her, that wasn't a big deal, but it was a big deal for you.
Yeah.
And those messages are so powerful. Mm-hmm. I think that's important that we're not afraid to tell people that too.
Yes.
Because it inspired you to be where you're at and have that faith to be your best self.
Yeah, yeah. It's different when people around you in your life believe in you, but when the person who has seen you grow into be the practitioner you are believes in you and says it just holds different weight, right? Mm-hmm. Holds different weight. Mm-hmm. So that's why I started body balancing physical therapy. And then, all of my skills have come out of my own injuries and pain. I had a foot injury when I was in college, and I was a collegiate athlete as well. And there were no answers for it. Really, the only answer was be in a walking boot for 6 months, and then I ended up with terrible SI pain and low back pain with no answer. And I was really miserable and so frustrated. And as someone who's moved their whole life, it was hard. It was so hard not to be able to move and not to be able to exercise, because that I didn't know at the time, but that was my mental release, right? Mm-hmm. That was how I was managing stress in my life. And then I started to meet wonderful PTs who were looking at the body from a whole picture not just treating the area of pain. And those were the PTs that were helping me. So I listened to what they were doing. They were all using dry needling. They were all using visceral manipulation. I met several pelvic floor PTs who were really integrating amazing work together. And that really helped my body. I learned that I was hypermobile as well, which I knew, but I didn't understand fully. So I was able to put all of that together and be able to move. I changed all my training to be able to move better. And I could do things again, but only to a point. My foot still hurt if I, walked over 5 miles, right? If I hiked to that point, if I did certain movements or if I biked too long. So it was really good. I could still live my life, but it wasn't until I had some really amazing energy work and worked with energy healing practitioners that I could go on a 9-mile hike and not have pain.
And how many people could probably relate to that?
Yeah, exactly. And I'm the one who knows the most about the body, right? Not the most, that was an arrogant statement. But I know a lot about the anatomy, right? In my own body. And to have that piece shift things that I was trying to shift for a decade, I mean...
But doesn't that say that too, coming from a doctoral of physical therapy? You said it, right? You should know the body.
Right.
But going back to where it does miss the mark in the traditional setting, what we're taught in school. We're not taught this in school.
No, we're not.
And it's after we graduate and we get into all these different tools and modalities and being able to layer that in and have that toolbox to provide the full healing.
Yes.
Which sometimes is that emotional component that's tied to the injury that gets embedded, which you could talk more on that, but and there's some things that maybe people, like you talked about dry needling, visceral, the pelvic floor. Do you want to go a little bit more into the different services that you really like to focus on?
Yeah, and I like to call them my tools because my service is really a body balancing session. And whatever we do in that session is totally based on your body, right? That person's body and what is needed that day, what their goals are. But there's lots of tools in the toolbox, like you said. Dry needling is a really amazing tool, and Nikki's had some really cool results with dry needling as well. And you're using acupuncture needles, but instead of following the meridians of the body, you're going directly into muscles, and it just creates this blank slate to learn something new. It resets your body and allows you the opportunity to change a movement pattern that's leading to pain. And visceral manipulation is another one of my just absolute favorites. And viscera just refers to anything in the body that's not a muscle, tendon, and ligament. All of our fascia, which is the connective tissue of the body, wraps around our organs, connects to our spine, connects to our muscles directly. So when we have an injury or a movement pattern that is creating problems, why can't it be the fascia around the organs that is the driver? Right?
100%.
Why can't it be that area if you have a traumatic fall or a traumatic car accident? I mean, we know we can bruise our lungs and our heart. That can still hold tension and create problems with your shoulder range of motion or your hip function. So
absolutely,
it's a super gentle technique that is really powerful. I also use neural manipulation, similar to visceral, but working with the fascia around the nerves in the brain itself. Similar to craniosacral therapy, if people have ever heard of that. You can also work with the cranial bones to help the whole body and nervous system function in more alignment. And then I come from an athletic background, so I have strength training experience and I have a Pilates background as well. And I found Pilates at the first clinic I worked at outside of school. It was all Pilates based, and I just fell in love with the reformer and what it did for my body personally, and love to use that with my clients. And Pilates is kind of in the now, it's having a moment in the zeitgeist for good reason. It's a way to really teach your whole system to work together and move with more ease and more grace so that you can go and do the things that you love.
And I love, just for me personally, you don't give me like pages of exercises to do.
Yeah.
you gave me one exercise. Tackle this one. It is
Very specific, right?
very specific, utilizing different components and very in alignment, and so and
Yes.
breath and all the different components. So I appreciated that too. Versus like, here, do all these things. Like, there is a place for that.
Yes.
100% there is a place for that, but at the same time, I also like the specificness that you had with your programs.
I like to tell my clients it's not the exercise, it's how you're doing it. Because I can give you a glute bridge, and if you're not using the right method, or if you're not tuning in with your breath and your core in the right way, it's not going to benefit you. So I want to really help people understand how to use the center of their body so that you can work outwards, and know that if you go to do a new movement, you know how to do it because you know how to use your core. It doesn't have to be this really stringent task. Yeah.
And also you focus on women's health and the pelvic floor as another area that you have as part of your toolbox. Do you want to explain a little bit more on that?
Absolutely. So I love that you highlighted that as women's health, because we need that care, but it's not just for women. Men and women can have pelvic floor dysfunction. And the pelvic floor are just the muscles that connect our pubic bone to our tailbone and our sit bones to our sit bones. And this area of the body is involved in bowel, bladder, and sexual function. So my clients are people who are maybe dealing with urinary leakage or constipation. Maybe they have pain with sexual activity, or they're dealing with ED. It's really a wide spectrum of symptoms that can show up that involve the pelvic floor. But it's really just orthopedic PT. We're just dealing with a different symptom, and we're able to assess that area of the body through further training. But the pelvic floor is part of our core, you know? We do not treat it on its own like anything else in the body. So I love being able to help people understand why they're having those symptoms, and then learn how to use their whole body to move again, or be able to be intimate with their partner, or be able to go in public without wearing pads, whatever it might be. It's really gratifying to make such a big difference in people's lives.
Well, it's quality of life.
Yeah, it's huge.
And especially when it comes to those different types of symptoms.
Yep.
A lot of people don't want to talk about it. They ignore it, or, you know, and there's like a fear component or an embarrassment. And it's not. This is just, these are very real things. Yep. And there's help for that. There's natural ways to be able to help and actually start resolving that. It's not you're getting old.
No.
I don't like that saying.
No, and I don't think we've done a great job about educating for this resource, especially for men. Men are really underserved with this service. And by the time I see a male patient, they've typically seen multiple doctors. They've gone through really embarrassing tests and really traumatizing tests. So we have a little ways to go just in the medical field in general to recommend this much sooner for men and women. But there's this improvement in education as patients start to research on their own, right? I have a lot of clients come to me because they've done their own research, not because they've been referred by a provider. So that's really fun to see.
Yeah, and really just spreading the message too. You know, I think that is the biggest thing, is education.
Yeah.
And bridging that gap between this holistic approach that is very effective, and then the traditional. And so working together with practitioners, educating the providers. And that's another thing I want to ask is collaboration. You know, especially in GOL, we're all about bringing community together, but also collaborating. And I see a lot of our providers within our group are collaborating, referring back and forth. Who are the type of collaboration that you like to work with?
Oh my gosh, all kinds.
Where do we start?
I love everybody. I really think there's such amazing providers in every area. There are wonderful chiropractors, and that's the right fit for some people. Sometimes you need an adjustment. Sometimes you need a whole plan of care from that provider. There's such amazing naturopathic doctors, functional medicine doctors, and I think it's not so much about the niche that I like to collaborate with. It's about that person and that provider. We know in GOL we're all coming from the same lens of looking at the whole body and the whole system and the whole person. So if I have a client who I know is dealing with some hormone imbalances, I know that if I refer out to somebody in this network, they're going to look at the root cause. They're not going to slap a Band-Aid on it. So there's all sorts of people I like to work with, and there's power in having multiple perspectives for client healing, for just person healing.
Yes. And it takes that, there's no ego in our group, and that's what I have appreciated, who's attracted to the GOL network, this directory of providers, the community as well, because we have an expansive, like the layers of the onion. But there's no ego.
Yeah, and I would take that even further. There's no ego, and actually everyone's operating from abundance. So there's no fear that if you refer someone out of your space or your clinic to someone else, it's not going to come back to you. It will. All of that will circle around, and people are putting others first, right? People, their clients first.
Patient-centered, client-centered.
Exactly.
Yes, where it's supposed to be.
Where it's supposed to be.
Yeah, it's definitely coming from Western medicine. I was 20 years in Western medicine, and that is there's a lot of reasons for GOL, but that is part of it, is creating a safe place for people to land, get education, start to get these different experiences with the providers, but also like, oh, now I have a directory of people I know, love, and trust. Yeah. And and they're vetted, and we know that they're leaders in this valley. Yes. And so when people come in, they can trust that they're going to be sent to somebody that is truly going to get to the root cause. Yeah. And do it in their best interest. And if they can't, they're going to refer to somebody else.
Yes, they know someone who will help.
Yes, there is always somebody to help.
Yes, there's always little helpers.
Oh, I love it. So just, like, do you have any final thoughts or anything else that you'd like to just share really quick before we end?
I just want to reiterate how important it is for your providers to be able to go to the depth with your body that's necessary for healing. And I've noticed that that's the type of person I draw in, and I want to continue to draw in. I want my clients to be able to go deep and know that that's where that healing really happens, whether it's going deep into a specific movement pattern, tweaking things ever so slightly, or it's going deep into whatever emotions their body are holding, and all of the above. That's where I really find my joy, and that's where my toolbox really shines. And I'm just so excited to continue to help people find their freedom again and find their life again.
True healing.
Yes.
True healing. Oh, thank you.
Yeah, thank you.
We're so excited to have you.
Yes, I'm so excited to be here.
Thank you guys for watching our podcast. And if you want to connect with Marissa, you can find her on our directory at thegolnetwork.com, or also at your website, which is
coming soon. But it will be bodybalancingpt.com.
And all of Marissa's information for your email, your phone number, you can find that on our directory as well. Marissa is in this process of development, which is we are so excited about, and we celebrate the wins of our practitioners, of our community. So do connect with Marissa. She has changed my life. I can now move my hip, and I haven't been able to move it in a year. So high fives to that.
Yes, I love it.
So do connect with Marissa. Thank you for being on here. Much love. We will see you soon.